In future, I hope that telemedicine plays a really significant role in my care and in the care of others as well. So I would really like to not have to travel to my cancer clinic for every single appointment. For some of them, I definitely want to go. There are times when we want to look our doctor or nurse in the eye and really have stronger communication. But for the most part, I would rather not have to travel. And I live really close to my cancer center. So I always think about people who live farther away. And there are so many people who travel hours. There are people who travel days to get to their appointments. There are people who have to leave their communities and be away for an extended period of time. And that's not something that I would want to do, especially, when we're undergoing cancer treatment, we can feel so alone and fragile. And I would rather that people had more support, had their people with them, could stay at home, could stay in their communities and just have a call. And their people could be with them if they wanted during the call. They can all gather around and listen in. And I think it matters so much. It's not just convenience, it's better care for people to have their loved ones near them. It's one thing we've learned during COVID, even more so, that it's not good to be alone. It's good to have our loved ones near us, supporting us. And so, as much as possible, if we can keep telemedicine as an option to use for the times when it doesn't really matter if we're in person or not, let's make that choice. Let's make second opinions available. Let's work out whatever permissions need to be in place for people to get care across regional lines or state lines. Let's get those things in place so that we can provide the best care possible. And let's always be thinking about our most vulnerable people. And those are usually the people in the rural and remote regions, the people with a really hard cancer diagnosis, the people who are feeling alone and vulnerable. Let's take good care of them.